tell you about tinnitus. Tinnitus, many of you must be suffering or having this disease mostly after the COVID or vaccines. It has increased a lot, and tinnitus is a sound which only you can hear. Neither your colleague, your family member, nobody hears that. It may be hissing type, it may be whistling, it may be like wind blowing or the ocean or like water or anything like that. It may be ringing, anything, a sound which only you can hear. It is a disease which occurs 24 hours continuously, and only when you are in some noisy place, many of the patients, the tinnitus sound gets suppressed and you don't hear that. So that does not mean that the tinnitus is cured or it is better. It is already there. So what are the basic causes for tinnitus and why the treatment till now in India and abroad, in whole of the world, nobody has reached at a tinnitus solution? Because tinnitus is a degenerative disorder. When the cells of the ear, the mastoid ear cells, they get destroyed. When there is nerve degeneration, there is a covering over the nerves, which is the myelin sheath, that gets degenerated. Then only possible solution throughout the world is regeneration. And dear friends, I am very happy to say that since last 1 year we are prescribing the medicines for tinnitus and hearing loss, CSOM, chronic suppurative otitis media, any discharge which is coming from the ears, which is coming from your recurrent discharge is coming. It may be watery type or very much thick, or many of the patients they get offensive discharge. Blood also comes mixed with blood. So our medicines are working on the degeneration process, degeneration of the nerves, degeneration of the bones, and the eardrum, the tympanic membrane, eardrum, which gets ruptured. It is a natural process. When there is discharge accumulated inside the ears, then that has to come out. So if it come out, it can only come out when there is the hole in the eardrum. So that is a natural process. After our medicines heals, regenerates, repairs all of the bones which are inside the ears, which are responsible for the discharge, that stapes bone, malleus bone and incus bones. Only then the eardrum starts repairing with our medicines. We have got thousands of patients who are satisfied, who have got results in tinnitus, hearing loss, CSOM, discharge, recurrent discharges, the Meniere's disease. Meniere's disease is any patient who is having a ear disease plus he is having vertigo side by side, sensation of vertigo, that is unbalance, unsteadiness feeling. So today you should be happy, you should be very much you should be thankful to the Almighty, to the God, to your Allah, that we have reached at that level. Today we are having thousands of patients who are better, thousands of patients who are 100% better. So you don't have to worry about it. We have reached at those medicines which are regenerative in origin, especially working on the ear pathology, curing and treating, repairing your tinnitus. There is no need now to go for masking. Tinnitus maskers are there, or sometimes we go for the sound deviations, which is not a permanent solution. And if we have got so many patients, that is itself a proof that we are giving medicines for regeneration of the nerves, for the cells responsible in the cochlea, the cochlear damage, the bones, the cartilages, the full inner pathology of the ears and the eardrum. You can watch more videos for our latest knowledge and updates and testimonials of the patients. Right now we are having most of the testimonials in Hindi, and later or sooner we are planning up, as our outreach goes to all over the world, we will be trying our best to give you other testimonials also. But have trust, this is not a video gimmick, this is not just a play, because I know, being a doctor, that what it feels having suffering from tinnitus or hearing loss when you are having everything but you can't hear. Thank you. Thanks a lot.